My guests this evening are Lindsey Vuolo and Robyn Oster from the Partnership to End Addiction. Lindsey Vuolo is the Vice President of Health Law and Policy, and Robyn Oster is the Associate Director of Health Law and Policy. The Partnership to End Addiction is a national nonprofit organization working to transform how our nation addresses addiction. Lindsey and Robyn lead the policy work at the Partnership to End Addiction and will be providing a recap of federal policies related to substance use and addiction over the last 4 years under the Biden administration. We'll conclude with a look at what we might expect policy to look like in the coming years. Lindsey, Robyn, welcome to the Kingfisher Project.
Thanks for having us, Bill. It's great to be here. Yeah, great to be here.
Let me just ask quickly at the beginning, what brought each of you to the partnership?
That's a great question. So I joined almost 10 years ago, which is sort of hard to believe now. And
wasn't even the partnership then, was it?
It wasn't. It was a few name changes ago. It was when I joined, it was the National Center on Addiction and Substance Abuse, or CASA. And I have a background in insurance and had really an interest in how to use insurance to really promote access to affordable health care. And so at the time, CASA was really looking for someone to lead their work around insurance coverage. They had just done a huge report called the Addiction Medicine Report, where they had really looked at how addiction has always, one of the major problems with treating addiction is that it was treated outside of the mainstream healthcare system. And that addiction's a disease, it needs to be treated under the purview of the healthcare system like other chronic illnesses. And the main funding mechanism for that is insurance coverage. And so I was really brought in to help lead work around policy research on insurance coverage as it relates to substance use treatment. And then as the organization has grown, we've now, Robyn and I now lead all of the policy work related to all of the organization's various priorities. So one is increasing access to quality treatment that is affordable, as well as prevention, and then how we can engage and support families who are impacted by addiction.
How about you, Robyn?
I came about 3 years later, so I've been here for 7 years, and I came in really just, with sort of an interest in health and social policy more broadly, and came in to help with that policy work, and yeah, have been working with Lindsey since on all of those priorities that she mentioned.
What was the Biden administration's general approach to substance use and addiction in the last 4 years? And you can bounce back and forth. You can take turns. I'm not the teacher. I'm not going to ask you to raise your hand.
Yeah, so I can start there. So Biden really identified the opioid crisis as a main priority pretty early in his administration. In his first State of the Union, he outlined a unity agenda, and the opioid crisis was one of 4 pillar issues as part of that. And so overall, as part of that priority, the administration really embraced a public health approach, so focused on prevention, harm reduction, treatment, recovery, and those types of approaches. And really notably in there, they were supportive of harm reduction efforts, and that was sort of a big first for this administration. And they did also take some supply side efforts, interdiction, addressing drug trafficking, and those sorts of things as well. So a mixed approach there.
When you say harm reduction, being new, certainly we've had our audience, I think, has an idea of what harm reduction is, but what made that significant, that adopting that approach? That was a change. What made it so significant, in your opinion, at least?
Yeah, so I think there were a few things that made it really significant. I think one was that, just sort of talking about it and including it in all of the administration's strategies for addressing the addiction and overdose crisis, and just sort of raising it up. I think that alone was sort of a big shift in just showing general support for these types of things. So whether that's naloxone or fentanyl or xylazine test strips or syringe exchange programs or things like that. Just sort of legitimizing those and making them a real option for people who need them. And then also really big was providing funding for these services. Those sorts of services are traditionally excluded from a lot of federal funding. So a lot of grants and things can't be used for those historically. And so the Biden administration was really the first to open some of that funding up and incorporate it as a main part of their response.
Yeah, harm reduction has a long history of being very stigmatized, so it's really not something that was embraced or really talked about at the federal level. And as Robyn said, there were some really stigmatized policies restricting funding for a lot of these initiatives, really, based on this belief that harm reduction encourages drug use or somehow like removes a deterrent. And I think, a lot of research has shown that not to be true. And also given sort of the magnitude of this crisis, when Biden came into office, overdoses have been very high and were climbing, just given a very deadly drug supply due to fentanyl, which is a synthetic opioid that was responsible for a large number of overdoses. And so there's really an incredible urgency to adopt harm reduction practices in order to keep people alive and reduce the risk for fatal overdoses, given the nature of this crisis. Was
there any resistance to harm reduction because harm reduction evolved out of the AIDS epidemic?
I think, there's, it's interesting because we kind of use harm reduction all the time, like wearing a seatbelt is harm reduction, right? And putting on sunscreen is harm reduction. And so there's just certain types of, I think there's really this belief, I think with the AIDS epidemic, with contraception or safe sex practices, there's this belief that if you reduce the risk of danger, that will encourage people to engage in the activity. And I think the same has sort of happened with drug use. It's like, well, if we reduce the risk of someone dying from drugs, then that will make them more likely to use drugs. And that just ignores like a lot of the very complicated and varied reasons that people use drugs. And so it's not really something that has been borne out or held up by the research, but it's often a sort of reasoning that people will use that, again, like adopting these practices will in some way encourage people to engage in these behaviors.
You may have already answered this between you, but overall, what were the biggest actions taken during the Biden administration to address the addiction and overdose crisis, or the biggest, or what you might deem the most important?
Yeah, so I think definitely the harm reduction piece is one big aspect of it. But I think beyond that, there were a few other things. I think the administration removed some restrictions on addiction treatment. So both for buprenorphine and methadone, which are medications to treat opioid use disorder, and then also for contingency management, which is used to treat stimulant use disorder. So those were some pretty big changes there. And then also just providing a ton of funding for mental health and addiction services, as well as some of the social determinants that sort of surround it that can often be, risk and protective factors for addiction. And then in addition to some of those regulatory changes around treatment, also really expanding insurance coverage and parity protection so that people could more easily access that treatment. I think those were some of the biggest.
Robyn, you said a ton of funding.
Yeah, not a precise amount, billions of dollars, and record level
funding?
amounts. What?
Sufficient funding?
Still not sufficient. It was, more than has been provided in the past, but for a crisis of this level, and for, really what's needed is like a pretty vast overhaul of this whole system. It was not sufficient for that, for sure.
Okay, I'm not trying to catch you up. I want to make sure people understand that this is a problem we still need to be addressing head on.
We are still vastly underinvesting in this problem. This is a problem. The opioid crisis alone, Robyn, not to put you on the spot for a statistic, but what is the economic impact estimates for the opioid crisis alone for 1 year?
I think it was like
1.5 trillion.
Yeah, I think it was 1.5
So
trillion
we're
in
talking
2020.
In 2020, we're talking trillions of dollars, and that's the cost of like not addressing this crisis. So we are not putting nearly as much money into this as we're spending on the impact of this crisis in terms of lives lost, healthcare costs, criminal justice costs. This is a huge economic problem, and it is not being nearly matched with the level of funding necessary to address this type of problem.
Money which could be recouped by saving lives and rehab so that people have jobs and are paying taxes and actually contributing to the system.
Yeah, and of course, you can't put a number on, the number of lives that have been lost and the number of families that have been impacted. That is, there's no way to attach a number to that. It's been absolutely devastating to millions of families across the country, and so we need to be doing a lot more.
Well, all right, given some of the biggest actions taken and money spent, let's go down the list here. Full credit where credit's due. It's the list you provided me. But prevention, and are these in order of priority in terms of the administration's view?
I don't think so. They were more just in order of,
How we think of the continuum.
yeah.
We usually think of prevention first.
Yeah. Okay. So help me with my original question. Prevention, in terms of the resources and the money that's been put into it, how successful were things?
Yeah, so I think in terms of how successful were things, that's like a big problem with prevention, is that it takes a while to sort of know how effective a lot of that was. So we won't see the outcomes of the prevention that the Biden administration supported for years to come. But I think that there were certainly some things that the administration supported that we know are effective prevention generally. So the American Rescue Plan Act provided funding for school-based mental health services, and a lot of the social determinants of health that I mentioned before are often those underlying factors that can contribute to addiction. And so even those things that aren't necessarily like super connected to addiction in their own right, they really can have a strong protective effect.
Yeah, I'll just add here, Bill, because we've been doing a lot of work on sort of rethinking substance use prevention. We actually our organization put out a white paper a few years ago, sort of thinking about the framework for prevention as starting much earlier in the lifespan, because research has shown that the roots of risk and protection for substance use are planted very, very early in the lifespan. And we've kind of been thinking about substance use as education assemblies in adolescence, but it's really much broader, and it really involves, addressing family stress and, things like poverty and childcare and sort of like these really big issues that are actually really important and have, a very profound impact very early on in life. And so when a lot of the COVID relief bills address some of these really big factors, a lot of them were temporary, they've since expired, but we were really working at that time to really try to tie the two crises together, right? Like the opioid crisis and the COVID and the pandemic, and how a lot of the pandemic responses would really have an impact on substance use over time, even though that wasn't sort of one of the articulated reasons for those interventions. And so that's something we really still try to create a lot of awareness about, is how broad substance use prevention is and how it encompasses a lot of things. The good thing about substance use prevention is the same strategies and risk and protective factors that prevent substance use prevent other negative outcomes, right? Like mental health problems, bullying, violence, school dropout. And so it's really about promoting like health and wellness among kids. And so, these strategies really investing very young, has a tremendous payoff, not only for substance use, but other risks. And that's something we've really been trying to raise awareness about. I think, as far as prevention goes, you asked about funding, the prevention we've seen over time, while federal investment in funding has gone up for treatment, it has stayed relatively flat for prevention. And even throughout the throughout the opioid crisis, there's been a lot of focus on harm reduction, on like things like naloxone. There's been a lot of focus on treatment. There's been much less of a conversation around prevention. And I think it's really important that we stay focused on prevention so that we can not only resolve this crisis, but prevent another crisis of this magnitude from happening again.
I hear you talking about the diseases of despair.
Yes, yeah, and things like adverse childhood experiences, and they're all there's so much connection, right, between a lot of these things. Iceland has this like very cool prevention program that they adopted in the 90s to address underage drinking. And it's a very there's a lot of components to it, but one of the things they did was to increase access to recreational activities, give kids something to do, right? Like keep them busy, provide sports, provide yoga, provide rock climbing, like match kids' different interests. And they saw that together with other interventions, they saw their rates of drinking come way down, underage drinking. And I think, in this country, sometimes when there's like budgets get tight, it's like the first thing that gets cut is the sports program or the arts program without thinking about the impact that these types of programs really have, and especially in preventing, other types of risks later. So I think, it's really expanding how we think about substance use prevention.
What about treatment? In the Biden administration, we're back here now.
Yeah.
What were they able to accomplish, or what was the administration able to accomplish in the way of treatment? And again, I'm sure we're talking about dollars.
Yeah. So in terms of dollars, I have an actual number for this one. So the Biden administration invested $82.4 billion in treatment, which was 40.6% more than the previous administration. So a big increase, but as we said, still insufficient. There's still only like a quarter of people who need substance use treatment are getting it. So obviously there's still a big gap there. But then I think some of the impacts that the administration had on treatment was actually beyond the funding piece and more the regulatory piece. They made some big changes to rules surrounding treatment that have the potential to really increase access. So one was that they eliminated the buprenorphine waiver. So that was providers had to obtain a special waiver to prescribe buprenorphine. And that was something that doesn't exist for other medications, but for this medication to treat opioid use disorder, they had to. And so that was a pretty small bucket of providers who had that. So eliminating that allowed, anyone who prescribes controlled substances can now prescribe buprenorphine. So that's a 15-fold increase in the number of providers who are eligible. We haven't actually seen that really translate into an increase in the number of people getting treatment yet. So that really signifies that there are still other barriers. One of which potentially is education for these prescribers. If healthcare providers don't know about substance use disorder or how to treat it, they're not likely to do so. But so the same law that eliminated the waiver requirement also required prescribers to undergo 8 hours of training on addiction. And they often, prior to this, didn't receive any training. So that is also a positive development, and another one where we haven't necessarily seen the outcomes from that yet, but hopefully going forward, that will really expand the workforce and help people access care more easily.
And symbolically, it's really important. Like 8 hours of training is, again, it's not enough, but it's symbolically important that I think it's an important step in integrating addiction treatment with the mainstream healthcare system. I mentioned earlier, our predecessor organization had done this big report and really found that healthcare providers are just not trained in substance use or addiction. It's not part of the training that they receive. They don't know what to do, even though this is a highly prevalent disease. They're encountering patients with it all the time. But they're not equipped or trained. And so this is a really important step, although like more needs to be done. And I think, as Robyn was kind of speaking to, why we haven't seen this huge increase in providers obtaining the buprenorphine waiver, it's because they still maybe like lack comfort, right, and clarity in how to prescribe the medications or just treat this population. They don't feel equipped. And reimbursement is another issue. But I think this training piece was really critical to sort of having addiction move more into the healthcare system.
Part of the problem being that medical schools, there's very little in the curriculum about addiction treatment to begin with.
Exactly.
What did Congress pass any important laws in that 4-year period during the Biden administration?
So I think the most recent Congress, the 118, so 2023 to 2024, didn't pass a ton on this issue. They passed a few related bills, but mostly related to, interdiction rather than prevention or harm reduction or treatment or those sorts of things. But the Congress during the first 2 years of the Biden administration did pass a few important things. So one was the American Rescue Plan Act, which we mentioned earlier. So that was really big for funding. It provided a lot of funding for mental health and substance use disorder services and some of those underlying factors. And then the Bipartisan Safer Communities Act also provided like a record amount of funding for school-based mental health services. And then there were sort of a lot of different bills focused on expanding access to treatment that were all rolled into the Consolidated Appropriations Act of 2023, which is basically just the big funding bill that came at the end of that year. A lot of policies were rolled up into that.
I'm still. Well, no. Let me go back first. Underneath all of this was the awareness, or certainly in the press, that Hunter Biden had his own problems with addiction. How much do you think that affected public reaction to positive results?
Hard to say. Oh, sorry.
Yeah, on a policy level, I don't know. I did think that on a sort of a messaging issue, there was a lot of focus on, I think, the impact of addiction on families. I remember like the New York Times did a big, piece on sort of asking for people to share about, families and their experience, really looking at the experience of family members. I think, a lot of that trial, there was a focus, it's very stigmatizing. Like a lot of, sort of talking about sensational parts of his story. And, I think there were ways in which it was sometimes used in a sort of to convey addiction in a very stigmatized way. But what was interesting that was coming through to me was sort of talking about the impact that it has on families and what families go through as our loved one is struggling, which I think is really important because we still are not really utilizing families to their full potential. Families play a really important role in every part of the prevention and treatment and recovery and supporting their loved one, but they're often not given the correct information. They're often actually, they're stigmatized and blamed and shamed. And when they go online, they find, frankly, bad information about what to do to help their loved one. And so I think it's really important that, and I think we're still, there's still not enough focus. And so that's an area where we need to continue to do a lot of work at the policy level, at just the cultural level, and certainly for funding. There's very little funding to support families. But I do think that was one thing that kind of came through to me while that was going on.
Well, and I may have come across this. I don't know what parents said it, and I may have come across through something that I read or heard through the partnership. But a parent who said addiction is not a spectator sport. Eventually, the whole family gets to play. And certainly, that's one reason I'm on the air on the radio, because we don't help families nearly enough. And the pictures, the images that we show of addiction don't focus on families. They focus on individuals and over needles and drugs and spoons and crack pipes and stuff like that.
Yeah, and the treatment system is very focused on the individual. Whereas, we know that families are impacted, right? We know the impact that it causes to the whole family. It impacts families' health, their mental well-being, right? It's a really challenging problem for families to be dealing with, while also trying to help their loved one, which is also often very difficult. And so really, that's what we do at the Partnership to End Addiction, is we really provide direct services and supports to families through education. We have a helpline, we have a coaching program. So we have a number of different resources to really help families that are impacted. And then, we learn from the experiences of families and what they're experiencing. That really informs our policy work and the different policy priorities that we're working on.
How would anybody go about finding the partnership?
So you can visit our website, which is www.drugfree.org, and you'll see, I think there's a Get Help tab, or you'll just see on the landing page how you can access our various resources.
Let me go back or move on, or both. One of the things that I've come to believe over the past few years, certainly since the loss of my son, is there's government action, which we've been talking about. There's the work of places like the Partnership that are large groups. My faith is actually in the work that's being done by small groups, by parents who have done things in memory of lost children. That it's the grassroots and small group stuff that is the real hope for change in our country. Any thoughts, agreement, disagreement with that idea?
I completely agree with you, Bill. And, the parents who have lost their children, and, the amount that they want to give back by changing policy, by speaking out, is so critically important. We often see, policies are informed by data and stories. So, we are trying to always generate a lot of research around what works and, try to develop evidence-based policy recommendations, but it's often the stories that are most compelling to policymakers. And I think this, that the magnitude of this crisis has really demanded the attention of policymakers, but so have the stories of people speaking up and sharing their stories and pushing for change. And, despite losing their loved one, working so hard to make sure that other families don't have to go through the same experiences they've had to go through. And so, sharing their experiences, or sharing how the different barriers that they experienced, and identifying and fighting for policy changes to change those barriers. I think that the work that they have done has helped to significantly change policy and move this crisis forward.
As you talk and deal with families, you going to be all right? As you talk and deal with families, what frustrations do you think you hear the most from family members? Robyn, you want to take a crack at that while Lindsey recovers here?
Yeah. So I think one is what Lindsey actually already talked about, was just that family members are really not included. And I think that is a big problem that's often identified, is just people don't know where to go for help and resources. I think another big one we see is not being able to access affordable treatment and the insurance, and navigating the insurance system, and facing denials, not being able to get into treatment programs or things like that, I think is a really common experience among families. I would say those are two of the big ones. I don't know, Lindsey.
Yeah, no, I think so. And just not knowing where to go to find good information. I think we hear so much from parents that they're so relieved to kind of land at our website and know that they're finding trusted information about what to do, whether, should they be concerned about their kid's substance use? How do they talk to their kid about it? How do they have an effective conversation with them? What do they do if their kid needs treatment? How do they find it? What do they look for? Those are, I think, all challenges that the parents are facing, but particularly around insurance. And we have such a long way to go on insurance coverage. It continues to be so incredibly hard. It's hard for people to convince their loved one to get treatment. And then once they do, it becomes incredibly hard for them to figure out how to get treatment and how to stay in treatment and how to make sure that treatment is paid for. And so we've done a lot of work to try to improve insurance policies around substance use treatment. We have a parity law. It's a 16-year-old law. There were actually new rules that were just passed by the Biden administration at the end of their term. So in September, they issued new rules, which are, really part of a series of incremental changes that have been made to strengthen and clarify the Parity Act. These rules, the important thing about these rules is they really require equal access to mental health and substance use disorder services, which they hadn't previously clarified, that the Parity Act really requires people to be able to access coverage in a way equal to how they're accessing coverage for mental health and substance use care. And so I think, regulators are hoping that the new rules will help result in being able to access care more easily. But that continues to be a huge area of frustration, is being able to access care and being able to pay for it. And again, often paying for it means having your insurance company cover it.
If I remember correctly, that instruction from the Biden administration came out right during the period when everybody was running for office, and attempted to put teeth in something, as you said, that's been 16 years old. So, I mean, the law has been there. It's taken a long time to get, and I'm skeptical whether it will, I'm sure you may be too, is there any chance that it will have more power, bigger teeth, stronger reach than it has?
Yeah, what we're finding is that parity enforcement is really complicated, and regulators need a lot of tools. And so, I think the rules don't do a whole lot more to provide, that much more enforcement power. That's going to be something that's going to have to come through funding. And so, I think it remains to be seen whether this will be a priority of the new administration to enforce these parity rules. But as so far, it's been very difficult to get the health plans to comply with the parity requirements or to reduce a lot of the barriers around mental health and substance use care.
Well, the 4 words you heard me using, the 4 words I used to describe the insurers are dodge, delay, deny, and dissemble. And maybe deny one more time at the end of that.
Yeah, it's been really challenging. And we continue to see people receive mental health and substance use care out of network at much higher rates. And that usually means, it's much more expensive. And quite frankly, just the health plans aren't paying enough to provide this care. And so, that's why the providers aren't participating in the networks. And then when they are participating in the networks, they're having to go through prior authorization requirements and medical necessity denials, and as you said, all these tactics to deny and delay care, which is frustrating. But with substance use disorder, it's life-threatening because oftentimes people can't wait another day. They're at risk for overdosing. They need to get treatment when they need it, when they're willing to engage with it. And so these tactics really provide an added level of concern when it comes to substance use.
As I talk to you both, I'm impressed. I have to say, I mean, I want to continue, but I'm impressed. Your comprehension and your ability to discuss this situation far exceeds your title. It has far more to do than just what's going on legally, and I thank you for that.
Thank you.
What else is needed? If you've each got a magic wand right now, what would you recommend, regardless of what administration is in office at any point? Because this crisis just continues on from administration to administration, and reaction to it wavers back and forth depending who's in office and how much it's politicized. But if we could get rid of nonsense and backward thinking, what would you like to see happen?
Yeah, I'd like to see, people used to ask me, like, I love the magic wand question. And I used to say, like, oh, I'm not, the frustration with the addiction is we actually know what to do. We've just lacked the political will to do it. And so it's like, how do you compel that political will that's needed to put the resources, to put the funding, to put the effort, to put the energy behind the crisis? And I used to think like, we're not going to see that. And then COVID happened. And you saw the federal government kind of mobilize, right, around getting out a vaccine and, really making like huge changes to, to laws, to rules, to cultural norms, to everything to address the crisis. And so I think that, one is we need a level of funding and continued funding that's really, again, matches the scope of the problem. And so the federal government has put out funding, but one of the ways they've addressed the opioid crisis is to put out these grants. They're yearly grants. They're called SOR grants, state opioid response. But what we've heard is that no one knows whether the funding will be renewed for the next year. So it's really hard to invest that funding in something like a treatment center, right, with just like 1 year of funding. And so really having to create like very sustainable funding so that people can invest in the infrastructure that's really needed, right? Is that building out more treatment systems? What does the healthcare system need to truly take on this issue? Like really understanding what's needed to make some of these really transformative changes. Looking again, we talked about how a lot of, the early risk factors for addiction, like we need to really invest in some of those big problems in order to really address the roots of this crisis. And then, the third thing, well, I'm waving my wand in many directions.
Please
but
do.
but the other would be like hold these insurance companies accountable, figure out how to get better coverage, force them to pay more money, to providers to actually, adequately reimburse for the cost of providing care or provide whatever, other supports that these providers need to actually provide care. And then the fourth thing, as I mentioned, is families and making sure that they're transforming the system to really be inclusive of families. Include them in treatment and make sure that they're getting in good information and that they know what to do when their loved one, when they're concerned about their loved one, so that they're not hiding and, not coming forward and not seeking the help and support that will help both their loved one and their family.
Thinking of one issue that we haven't talked about yet. Cannabis currently is a Schedule I drug, which is an artifact from long, long ago in the history of addiction in this country. What are the chances of getting cannabis moved to what are the chances of it happening, and what are the advantages of cannabis becoming a Schedule III drug?
Yeah, it's a really good question. I don't know. I think like a lot remains unknown about whether the rescheduling is going to happen. The rescheduling, I think the main reason for that is for research purposes, to be able to do more research around cannabis and its effects on health and other things, just to be able to, the Schedule I designation has made it very, very difficult to research it. And so I think, that's been one of the thoughts about rescheduling. I will say, not related to your rescheduling question, but in our prevention work, we have been really looking at cannabis legalization because it's happened now in half of the states. And with legalization comes commercialization, which carries with it risks to youth exposure and access. And what does it mean, for if these substances become easier for youth to access? Youth usually use substances that are legally available, and so just having really like strong protections around those substances. And so, we've been here before with cigarettes and alcohol, and so we actually did a report looking at what is a comprehensive set of evidence-based provisions to really protect youth in legalization, and really making sure that's the priority. And what we've really seen in legalization is that public health and youth protection are not the priority, right? The priority is more of the setting up the market, getting, the tax refunds, or tax revenue rather. And so just the focus really hasn't been on youth, and that's been concerning. And I think also having it be Schedule 1 and illegal at the federal level has made it difficult for the federal government to kind of put out guidance around this. And so there's been tremendous variation at the state level, every state kind of doing it differently. And that's what we had found when we did our report, where we came up with this set of evidence-based recommendations. We also looked at what's going on in the states. What are the state laws and regulations in the states that had legalized adult non-medical use? How do they match with kind of these recommended provisions? And we just found tremendous amount of variation. And the National Academies of Science, Engineering, and Medicine came out with a report at the end of last year, basically finding the same thing and saying that there really is an important role for the federal government to play in promoting public health, and in putting out best practices for legalization, and including, prioritizing youth protection. And so it's something that, we're really interested in. I think, not sure what's going to happen there, but I think that this is so widespread at the state level, that there is, I think, a role for the federal government to really play here.
Well, the partnership offices are in Midtown Manhattan, and I'd be willing to bet that all you have to do is walk out outside your office for lunch break or coffee break or something, and you can see evidence and smell evidence of failed marijuana policy in the city of New York.
Yeah, we've actually, we're just looking into that. I can actually see one out right from my office window, which I felt such irony in when we were doing this report, and I was like looking out at a shop that was opening. New York State, when they legalized, didn't give clear enforcement authority over the illicit market. And so that really led to a proliferation of illicit retail shops, particularly in New York City. They've now since kind of changed the laws and through budgets and other policies to give greater enforcement authority to go after some of these illegal businesses. Really complicating cannabis at the same time as like legalization's really been getting underway. There was a loophole in the Farm Bill, which basically legalized hemp. And then from that, they created kind of a synthetic cannabis. Is that right, Robyn?
Yeah, there are these like often synthetic, like hemp-derived other intoxicating compounds that are, in marijuana, it's the Delta 9 THC is what we usually think of, but these are other similar analogs, basically. So it's your Delta 8 THC or THCO or different things like that are very similar, but are derived from hemp, which was made legal, rather than marijuana, which is still illegal at the federal level.
And so a lot of what we might be seeing too are illegal, this intoxicating hemp that's being sold, not necessarily cannabis, which is obviously super confusing to the consumer. And so you have maybe a regulated cannabis market, but a non-regulated intoxicating hemp market. And so it's really been a challenge, I think, for states as sort of these products have come on in addition to legal marijuana.
Is there anything that has happened in the Trump administration so far that we need to know about? And what are you watching for going forward?
Yeah, so at this point, there's still a lot that isn't known. Addiction wasn't sort of a top campaign topic, except kind of being talked about, in the context of border security. The only thing that has really happened so far is that there's been an executive order to designate drug cartels as foreign terrorist organizations. I think, that's still kind of being worked out whether or not that will happen. But I think, one of the concerns there is whether that leads to greater criminalization of drug use here, where people who are engaged in sort of buying and selling drugs, often people who have substance use, are now going to be, facing higher penalties because of a foreign terrorism charge. And so, I think in general, we're kind of expecting this administration to take more of a punitive interdiction-focused approach. And what usually happens in administrations is that drug policy, again, there's kind of a split between, supply side interdiction strategies and demand side, more treatment public health strategies. And they're usually about the same level of funding, and then they, more funding goes to one than the other. So then, there's a concern that kind of a greater focus on interdiction, punitive approaches could mean less for treatment and other, treatment prevention. I think certainly harm reduction is there's not going to be much support for harm reduction at the federal level with this administration. I think they just have very different views about harm reduction. And so, I think we're kind of waiting to see what some of the policies may look like, what some of the positions are going to be. Obviously, the federal government has a really important role to play, as far as setting policy, as far as the support and the resources and the funding that they provide, especially down to the states. And so, they obviously can play a huge role in this, and we're waiting to see. I think what we're concerned about is, kind of shifting the focus away from a public health approach, as well as, just more sort of punitive rhetoric around substance use, can kind of bring back stigma against this, which is sort of stigma is really what continues to undermine, an effective response to this. And I think another big issue is around insurance coverage, particularly Medicaid. Medicaid is the largest funder of substance use disorder treatment. And so if there are significant changes made to the Medicaid program, either affecting eligibility or benefits, that could really limit the number of people who are able to access care, and which we already talked about is already very low. And so, anything that would reduce the size of the Medicaid program, as well as sort of some early administrative actions have sought to go after enrollment in the Affordable Care Act, in subsidies and other enrollment efforts really increased under the Biden administration to bring the levels of uninsurance very low. And so the more people that are uninsured, the more people aren't able to access treatment through insurance. And so those are kind of the things that we're really focused on. And I think it's important to note that, as we mentioned at the beginning of Biden administration, overdoses were very high. They had been climbing for several years. They've come down recently. And so we're at this really critical point where overdoses have dropped. There's sort of a number of contributing factors. We're not sure exactly what is contributing to that trend. But I think there's a lot of concern that any abrupt changes in federal policies or federal funding, or just a general, change in support from the federal government could really undermine those gains. And I think it's really important to make sure that we're doing everything we can to keep overdoses low and to continue this trend, to see them drop. That's where we want to be at this point. We don't want to have to return to an increase in overdoses.
At the beginning of your answer, you mentioned border security. And I think I'm correct that actually the number of people that are arrested for smuggling, for drug trafficking, are not Mexicans. They are American citizens who are employed or taking the risk to smuggle drugs into this country. Is that correct?
Correct.
Yeah, it's 90 some odd percent are U.S. citizens, and the vast majority comes through ports of entry.
Legal ports of entry.
Legal ports of entry. So it's not even, through parts of the border that are not monitored or anything like that. It's coming through the ports of entry. And yeah, so it's sort of a separate issue, even though they are often tied together.
And the other question is, and as I heard you answer it, Lindsey, makes me think about all the pardons that President Biden issued for low-level drug offenders. Suddenly, it makes me fearful that those are just some empty jail cells waiting to be filled by changes in policy.
Yeah, Robyn, do you want to talk a little bit about the pardons?
Yeah, so there were, sort of two buckets. One was a pardon for simple marijuana possession offenses at the federal level. And then the other was a pardon for like over 2,500 people with nonviolent drug offenses. And that was really to account for the fact that a lot of these people were sentenced, years and years ago and received these really, really lengthy sentences that now, policy and practice have changed to not punish a lot of those offenses quite as severely. And so this is obviously like will have a big impact for these individuals. But yeah, I think you're absolutely right that if policy starts to go back the other way and there's, more emphasis on punitive responses or any new laws that increase sentences or mandatory minimums or things like that, I think that certainly could shift back the other way.
And we've seen that with sort of like there's been a lot of focus around drug-induced homicide laws in states for overdoses that involve fentanyl, right? And so we've kind of seen this sort of shift, a little bit of a shift back to more punitive approach as like a way to address fentanyl. But all the research really shows that like criminalization and increased penalties really are not effective in addressing addiction. They don't lower overdose rates. They don't lower, the availability of drugs. Again, there's like a lot of complexity around why people use drugs, excuse me. And so, anything, I think, diverting resources and attention to these things that we know are ineffective, is another thing that we're concerned about, and away from more effective public health-based strategies.
But what if you had concluding thoughts, or if there's anything we haven't covered? I mean, we could go on for days, I'm afraid, but if you had any concluding thoughts, I'd like to hear from each of you what where we might head, or what you might like to see, or what you feel good about. I mean, you do come into work every day and continue to work on this problem.
Yeah.
I mean, it must be frustrating at times.
It can be very frustrating. But I think, this was like a really helpful exercise for us to kind of look back and see what the progress has, what happened, right? And sort of like where we moved forward on things. And so I do think that the path, has been forward, and it kind of has built from each administration, even through the first Trump administration. They did a lot to address substance use and addiction in the first administration. A lot of, public health oriented strategies too. And so, we hope we can kind of continue to see us going down this road. Again, what's frustrating is, as I said before, like we know what to do, we've just lacked the political will. And so I think keeping policymakers, focused on this issue, I think will be really important. I think we lost a lot of champions on this issue in Congress. There were, a lot of people who were really focused on this, and they're not currently in Congress. So seeing who kind of the new champions on this issue will be, it's still something that affects, everyone. Everyone is touched by addiction. And so that's not going to change. And so it's going to have to continue to remain a priority. And so, it can be frustrating, but also, I think it's really important, and there's reason to have hope. This is still a bipartisan issue. It's still an issue where there's like pretty widespread public agreement that more needs to be done to address mental health and substance use. There's pretty widespread agreement that substance use is a health issue. And so all of those things I think are encouraging signs that we'll continue to move in the right direction.
Do you have any guesses on who might be appointed the drug czar ahead of Lindsey? We lost Lindsey. There, you're back.
I'm back. I'm sorry. I keep battling this cough.
Yeah, I don't think we have not really heard anything about who's going to be the head key. You know, Trump has made nominations to a lot of the other health agencies so far, but none have received confirmation yet. They're all going through their hearings. Robert F. Kennedy Jr. is having his hearings to be HHS secretary now. And most of the other agency heads have not had their hearings yet, and I have not seen anything yet about who is going to lead ONDCP.
If there's been a theme while we've been talking, I've heard, and I hope our audience has heard, a number of times about summoning political will. What can we do? What could people in our listening area, people that listen to this program, what can we do to help strengthen or summon political will? Any thoughts on that?
Yeah, I think, speaking up, contacting your representatives, whether they be your federal representatives, your state, your local, this is not this is not just a federal issue. This requires the support of every level of government. And I think, people can advocate in a very formal way of, for certain legislation or policies or bills, but also just sharing your story. This is how this happened to my family. This is how I was impacted. I think is really, really important. And I think that's something that many years ago, members, policymakers weren't hearing those stories from people. Families and individuals were not coming forward because of the stigma around addiction. And while we continue to speak out, that really does a lot to combat the stigma that still continues to be very pervasive. And so I think speaking up and telling your policymakers, like, this is an issue that we really care about, and it needs to be, remain a priority, or it needs to be prioritized.
And I think, as Lindsey said, you can do that at, the local level, the state level, the federal level, and just sharing your story or talking about it generally as an issue that needs to be addressed are all super helpful. But if people want like a more concrete way or don't really know what to say or what to talk about, like, we on our website will have action alerts, which are pre-written letters to Congress, so only at the federal level. But so people can look at the different bills that are currently introduced on this topic and just fill out a form basically with their name and their address, and the letter will go directly to their members of Congress. So we don't have any yet. So for right now, definitely the action is just to, generally share your story or ask for this to be a priority. But going forward, if people want to advocate on specific federal bills, they can do that.
And we have an advocacy toolkit too, in which we talk
Yes.
about different ways that specifically written for families and how families can advocate, again, from sharing your story to, meeting with your member of Congress. There's all different ways to be involved.
And remind us again one last time, if you please, where would you find that stuff on the partnership website?
Yes, which is drugfree.org. To find our advocacy page, you can go to get involved, and then advocate for change. And you'll find the advocacy toolkit, and that's where we will have the action alerts once they come out. And then I will share this year at drugfree.org/insurance, we created an insurance resource center. So we have several tools and resources there about how to navigate insurance and what to do if you're denied care, and different resources that folks can use.
Thank you for that.
You're welcome.
That's all we have time for today on the Kingfisher Project. My guests have been Lindsey Vuolo and Robyn Oster of the Partnership to End Addiction, and it's been an informative and most helpful conversation about federal drug policy. Thank you for joining me, Lindsey.
Thank you, Bill.
Thank you.
I'm Bill Williams. Be sure to join me next month for another edition of the Kingfisher Project, Information Against Addiction, right here on Radio Catskill.